Welcome to ThinkTech on OC16, Hawaii's weekly newscast on things that matter to tech and to Hawaii. I'm your host, Duke Oishi.
And I'm your co-host, Maria Kashem.
In our show this time, we'll cover the program on healthcare in Hawaii, recently presented by ThinkTech and the Hawaii Venture Capital Association at the Plaza Club.
It was called Healthcare in Hawaii, How Affordable is the Affordable Care Act, and featured some of the most important healthcare officials in our state.
Our moderator for the program was Ginny Pressler, Executive Vice President of Hawaii Pacific Health, the largest healthcare provider in the state.
The Affordable Care Act and health transformation. There is a lot of confusion, but like it or not, it is a reality. The Affordable Care Act became law on March 23rd of 2010. That was more than 3 years ago. And in Congress, the House has attempted more than 30 times to repeal the Affordable Care Act to no avail. And as we all know, it's also been challenged in the Supreme Court and has survived. So whether we like it or not, the Affordable Care Act is in fact the law of the land. So I think it's a good idea to share with you a little bit details so that you have a better understanding of what's going on. Now, many changes have already been implemented in the Affordable Care Act. You may or may not be aware of them, and our panelists are going to hit on the highlights of those so you have a better understanding of that. But the biggest change is yet to come in the next 6 months, which, as Jay alluded to, and that's as we get the insurance exchange implemented, as well as the individual mandate.
The panel itself consisted of Matt Delaney of the Hawaii Group, Gordon Ito, Insurance Commissioner, Tom Matsuda of the Governor's Office, Hilton Raethel of HMSA, Steve Robertson of Hawaii Pacific Health, and Nadine Tenn Salle, President of the Hawaii Independent Physicians Association. It was an impressive array of officials in the healthcare industry of our state.
Okay, everyone, you've done with your lunch. Put on your seatbelts and put on your racing goggles. This is the ACA in 5 minutes. And also because my word is impact, and I hope that you will at least have some sense of why I'm saying that by the time I'm done. I'm the ACA Implementation Manager in the Governor's Office. I've had this job for about 9 months now. And my job is simply to facilitate all of the work that the state is doing to do its part to implement the act. I'm very fortunate to be working for a governor who is a very strong supporter of the Affordable Care Act, and he actually views it as a stepping stone to the larger issue of healthcare transformation in this state, and ultimately to improve the health of all of the people of this state. So that's the context that I'm working in. And what is Obamacare? The full name of the act is the Patient Protection and Affordable Care Act. And I think that title says a lot. We call it in the work day the ACA, so I'm going to be referring to it as the ACA. It is the most ambitious social legislation passed by the U.S. Congress in at least 50 years. The statute alone is well over 1,000 pages long. And the regulations that are being written as we speak to implement that act is into the tens of thousands of pages.
The word I'm going to use is really transition, and I'll explain why. In particular, with respect to the insurance division and the oversight of insurance, there's one particular area I really like to start off with, and that is really with respect to the Prepaid Healthcare Act that was passed in 1974, 39 years ago, because I think the Prepaid Act really sets the context of ACA. And so let me give you some brief background on the prepaid law. Some of the goals for prepaid was one, to reduce the uninsured population. And someone had estimated back in 1974, the uninsured population in Hawaii was, in one estimate, was as high as 30%. As a result of prepaid, at one point, Hawaii had the lowest uninsured rate at about 5%. Today, we're about somewhere between 8 to 10%, or about 100,000 individuals in Hawaii are uninsured, even though we have prepaid. Another goal of prepaid was really to cover major medical expenses and to protect an individual from really financial crisis in case of major medical and they didn't have insurance.
I'm going to talk just for a few minutes about what's happening on the insurance side of it and how it impacts you as either an employer or as an individual. We have developed products for the exchange just like other insurance companies have. Well, not all insurance companies across the country. In Hawaii, as far as we know, it's only Kaiser and HMSA that have developed products for the exchange for both individuals and small businesses. And for individuals and small businesses who go to the exchange, they are eligible, individuals are eligible for subsidies, and small businesses are eligible for tax credits if they purchase products on the exchange. Now, not every individual and not every business is eligible for the tax credits or subsidies, but they are available. The only way to get them is through the exchange. However, starting in 2014, the exchanges actually go up in October 1 of this year. But starting in 2014, when the Affordable Care Act actually kicks in, HMSA and other plans will continue to offer products off the exchange. So you don't have to go to the exchange. If you don't qualify for the tax credits or the subsidies, you can still purchase insurance, but you don't have to go through the exchange to do that. However, the subsidies for individuals, the tax credit for business are only available in the exchange starting in 2014. Now, one of the other changes that is occurring is that historically, and in Hawaii, as we talked about in prepaid has, and all the evidence tells us that prepaid, as we just talked about, very innovative. It's had a huge positive impact on healthcare in Hawaii since 1974. But we as an insurance, we have traditionally dealt with businesses. Well, with the exchange, we anticipate that we'll be dealing a lot more with individuals. So we'll go from a business-to-business model. We'll still be doing a lot of that, but we'll be doing a lot more of business to consumer. So what does that mean for us? So we have, for example, we're working on a website. We want people to come to us to learn about ACA, what's out there, what they might qualify, what they might not qualify, whether they're a business or a consumer.
My word is partnerships. When you really look at what we really have to achieve with accountable care, it really requires partnerships and teams of providers working with the health insurance companies, along with our patients. It's really critical. And when I talk about healthcare providers, I mean hospitals, doctors, home health, skilled nursing facilities. And these partnerships have always existed, but something dramatic has really changed. It's a revolution in healthcare. It's like nothing we've ever seen. Now, if you're not part of healthcare, you may not be aware of this, but it's been compared to the advent of the Gutenberg printing press. Because as you recall, if you remember your high school history, when the printing press came out, it completely opened the doors to information. It really was the beginning of the Renaissance by enabling information to the masses, so it wasn't just held among the scholars. That is what is happening now in healthcare IT specifically. So a few years ago, there was only less than 30% of providers even had an electronic health record. Today it's 70%, and we're pushing it up to 90% within a year or two. And the amazing thing about this is these systems are now beginning to talk to each other. So when we talk about partnerships, it's hard to have a partnership when you cannot communicate with your partner, or if you don't have the information that you need to really make decisions. So that is what we're seeing today. So every health provider that you talk to today is thinking and talking about this. So even the state today has health information exchange, where we're tying these systems together. And I once heard a doctor, after accountable care was explained and what all this ACO business really was all about, said, well, damn, Steve, sounds like everybody's being held accountable except the patient. How are we really going to improve care if the patient isn't taking responsibility for their weight, or keeping their cholesterol in check, or keeping their diabetes under control? Because we know that something like 80% of all costs are generated from 20% of the population, and the majority of those costs are tied to chronic conditions.
So as Tom mentioned, this 15,000 pages, my word is confusion. We're HR professionals and we're confused. I haven't read through the whole thing myself. is Gordon showed us the prepaid healthcare book. We're experts there. I mean, that's one night reading. But really, from a business standpoint, a small business, there is a lot of complexity, a lot of confusion. But first, I just kind of wanted to clear the immediate air. The prepaid healthcare back in '74, I mean, our leaders and business people back then were way ahead of their time. It's way better than this Affordable Care Act in regards to what it gave employers and employees. But just to delineate a couple of things, and so this is where there's more confusion, is generally federal law is more important than state law, but our state benefits here with prepaid are even better than some of the things with the Obamacare. But if you're in Idaho and you never provided benefits to your employees, it's a big shock and it's a huge expense. Us as business owners here, we've always had to do this since 1974. You're on the mainland now, the requirement threshold is much higher than here. It's 50 employees, it's day 91, and it's working 30 hours or more a week. So there's this trend in the country, like the biggest movie theaters, that are all going to shift their employees' work schedules to 29 hours so they don't have to comply with this. At some point it'll catch up and they'll keep doing more regs and changing it. But Hawaii, it's one employee, right, 20 hours or more for 4 consecutive weeks. So it's a burden we've already had. So just wanted to really confirm, nothing's going to change from your ability. Sure, at some point, and we're going to hear more about how will costs go up, but in the first couple of years, they're not going to be dramatically different. The major issue with employers is the whole compliance piece of it, the reporting. On or before November or October 1st of this year, every employer has to send a letter out to every employee by law talking about what the healthcare connector is, how they can access this, what it means. So if it's not done right, just picture how confused we are now. Your employees are going to get this letter and be even more confused.
I think the word that I'm going to surround myself with is transformation. It's actually the word that I used when we met last year, when we were still questioning whether or not the Affordable Care Act was coming. But now that we know that it's here to stay, I'd like to be able to address a little bit of how we're going to transform. The panel has had a little bit of time to touch on the government, the policy side of the Affordable Care Act, the payer, the insurer, the business model of the payer, the Affordable Care Act. And I'd like to touch a little bit more on the clinical patient end. To give you a sense of why, not that why you should listen to me, but what perspective I might be coming from, I'm going to typify myself just a little bit to both tell you a little bit about myself and then what healthcare providers or what our community looks like here in Hawaii. Like, for instance, I'm in private practice. I do both pediatrics and internal medicine, which is adult medicine. And my private practice is on the Queens Medical Campus, and I'm in a solo practice. And I'm still one of the rare birds that actually admit their patients to the hospital. And what is that in contrast to our community? Well, about 65, maybe 70% of our physicians are in private practice. They're in small groups, as opposed to larger groups that you'll often see on the mainland. As opposed to being a rural physician, maybe on the neighbor island that has to struggle a little bit away. I'm a very medical campus or hospital-based patient in the sense that I have access to a lot of the specialists, so I stay close to them. And I'm a physician that'll probably, just to give you a sense, my children are 8 and 10, so I'll be practicing for the next 10 to 15 years. And that's in contrast to an aging provider population that more are probably going to retire in the next 5 to 10 years. We're looking at about 40% of our present primary care physicians retiring, and that we know through the JABSOM study that was done by Kelly Withy that we are going to be across the board 20% short of physicians, particularly primary care physicians. And the last part in which I'm just going to typify myself as I address this question about the Affordable Care Act is many of you may have it in the back of your mind, but You know, when physicians are given their medical degree, we're asked to take an oath. You know, it's called many things. The physician oath is what it's called, which is the Geneva Oath. A more popular term for it is the Hippocratic Oath. It's back from, you know, prior to Christ, and it was reaffirmed back in 1948, just after the Nazi war era, in which both the courts of law, as well as I think our civilization at the time, wanted to come up with a universal understanding of what is it that we should expect of our physicians. When a patient goes into a room, or when we think that physicians are acting, what is the universal things that we should expect of them? And there are about 12 things, and many of you have probably heard them, but I think two that ring out very strongly is that above all, patient health will always be my priority. There is no Affordable Care Act, there's no law that is supposed to undermine that. And that there will always be a respect for human health. That being said, does the Affordable Care Act add, or is it going to detract or make my life difficult to do what it is that I've solemnly pledged to do? And I think, in essence, despite it being a very difficult path ahead of us, it is going to add to my job. And it's because I think, in essence, the Affordable Care Act is trying to get us to switch from a quantity, caring for sick people, and basically I'm a thriving physician the more sick people I see, as opposed to shifting to a quality base in which it's my job to keep not only my individual patients well, but my population, meaning the practice, the group that I have pledged to take care of. So from that standpoint, I think it will help. The hard part, where you're going to hear the bitching and the moaning, is we're not set up for that. We have a business model, an entire structure for sick people. And the transition behind that is going to be a huge undertaking. And I echo with what Steve was saying. This is where there's going to be partnerships.
As was clear at the program, we're in a time of change in many ways, especially in healthcare. Is it the best of times, or possibly the not so best of times? We'll see soon enough.
After a year of transformation, it's clear that the Affordable Care Act, Obamacare, isn't easy to understand, and a lot of people are confused about it. It's not clear how this law will play out, or that it will play out so well, on the mainland or here in Hawaii.
But one thing is clear. It'll have profound effects on the healthcare industry and on the insurance and governmental structures around the healthcare industry and on us, the patients.
One other thing is clear. It will change the way the healthcare industry does business with us and the way we do business with them.
And it'll change the money. All indications are that it's going to change the money big time. Get ready. It'll pay for us all to become educated on the subject.
And, of necessity, it will also change the way we care for ourselves, since it is we who care and should care the most about our own health. And these changes will make that clear, in terms of the quality of care, the cost of care, and the ultimate responsibility for that care. The good news is that as a community, we're likely to be healthier.
Get ready for these changes. Some you may like, and others you probably won't like, but all of which are coming, and soon.
Our panel, taken from the heart of the healthcare industry, was really great and helped us get a handle on what's happening and likely to happen in this new world of the new healthcare in Hawaii.
If you want to listen to the entire program we presented at the Plaza Club, you can. We'd broadcast it on our internet radio channel on Spreaker.com. You can find it there or on YouTube. Links are on our website at thinktechhawaii.com.
The short URL is tinyurl.com/Hawaii Healthcare for You, as shown on the screen. Check it out. This was an important and valuable program, just the way we like them here at ThinkTech Hawaii.
And now, let's take a look at our ThinkTech calendar of events going forward.
Check out ThinkTech's 4 to 5 p.m. Drive Time radio series on KGU 760 AM for Energy on Wednesday, Asia in Review on Thursday, and ThinkTech Fridays on Friday. We also stream video and audio of all our shows live on the internet, and we replay them all day long on ustream.tv. Visit thinktechhawaii.com for our live stream and YouTube links. Raise your awareness on ThinkTech Hawaii.
On Thursday, July 25th, the Hawaii Venture Capital Association and ThinkTech will present a luncheon program at the Plaza Club entitled Drones Over Hawaii, featuring a discussion of the technology, the ethical and legal considerations, the related business opportunities, and the implications for foreign policy. The program will be moderated by Peter Crouch, Dean of the College of Engineering at UH Manoa. You can sign up for these programs on hvca.org.
And now here's Bill Spencer, President of the Hawaii Venture Capital Association, with this week's Spensation.
Well, that was really something, Bill. I must say, it had such a good feeling about it. Those guys, the panelists in the healthcare program, they kind of came together somehow. And the one common denominator I found, call me corny about this, but I think they really cared about the health of the community. It wasn't just a business matter, and it wasn't just a government matter. I think from a moral point of view, they were concerned for us, all of us. That's what I felt.
I agree, Jay. I think there was concern, but is there still confusion? Are you confused?
Oh, I'm confused. I think it's very complicated. And I think, what I got out of this, which I didn't say at the program, is that, like everybody thinks that when you pass a bill, that's it. And it should be self-executing. Everybody should understand it pretty much. And no, there might be some wrinkles, but we know what's going on. That's not the case here. I think this is going to be just the beginning. I think there's going to be all kinds of interpretation issues, all kinds of practical workaround solutions, and there'll be amendments, too, to clarify it. We're headed down a new path, and we don't know exactly what it's like yet. We got to find out.
Well, already, the bill itself was 1,000 pages, and they mentioned that the regulations are approaching 10,000 pages. So that's 10 pages of regulations for every page of law, which is pretty astounding, considering that Hawaii, in many ways, already beat Obamacare to the punch. We've had the Prepaid Healthcare Act since the 90s, and this does essentially what Obamacare does, which is mandate a certain level of coverage. And in fact, it's more aggressive than the Affordable Care Act. And the interesting thing was when Gordon Ito held up the pamphlet that tells employers how to implement it. It wasn't more than 15 pages long. So I think that was a real testament to not only Hawaii's anticipating the need to have broader-based care for our community, but also how we were somehow able to take this law and put it into terms that people can understand.
It's really so interesting. We've been ahead of the country for a long time in this area. Good for us. And now the Affordable Care Act comes up, and in some ways, I have to say this, in some ways, we're going to be going backward. But we're part of the country. The country has to come up to the standard. We all have to work together on this. And Hawaii will find a way to be a leader in understanding and interpreting and executing, implementing this new law.
Well, I think the other thing, though, that the law does account for that's new is there will be a better safety net for those that are uninsured, which amounts to about, 20% of the population. I think the healthcare connector function is going to go a long way towards matching people better than either just having you miss the boat completely or go on Medicaid, which the states have a hard time affording. And then, of course, the provision that prevents insurance companies from discriminating against folks with pre-existing conditions. That's a dreadful situation that should never be, and it's too bad that it took a law to make the insurance companies toe the line there. But overall, I think those are some really good provisions, and we need to give it a chance to evolve. Like you say, there will be amendments. And hopefully the Congress will just quit trying to kill it and get on with more important business.
It was a great program. Ginny Pressler was a great moderator. All the speakers were really fine. They were committed. They were caring, and I really got a great feeling out of it. And you know what, Bill? Just as we said last week, what did we say last week? As housing goes, so goes Hawaii. Well, even to a larger extent, as healthcare goes, so goes Hawaii and every one of us.
Absolutely, Jay.
Thanks, Bill.
Thanks.
We'll be right back to wrap up this week's edition of ThinkTech. But first, we want to thank our underwriters.
Hawaiian Electric Company and its affiliates Miko on Maui and Helco on Hawaii Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company, and CEO of CBI Polymers, a tech company in Hawaii.
The High Tech Development Corporation, the state's leading technology agency attached to the Department of Business, Economic Development, and Tourism.
Castle and Cook Hawaii, with a time-honored legacy that spans more than 160 years and revolves around its mission of investing in Hawaii, creating communities, and providing for the needs of our state.
Hawaii Gas, formerly the Gas Company, a proponent of the Liquefied Natural Gas Initiative, helping Hawaii achieve its transition to clean energy and a better energy future.
Collateral Analytics, a Hawaii-based tech company empowering the real estate industry with greater and faster access to the tools and data they need to make better informed property investment decisions.
Okay, Maria, that wraps up this week's edition of ThinkTech. Remember, you can watch ThinkTech on OC16 several times every week. Can't get enough of it, just like Jay Fidel does. For additional times, check out oc16.tv.
Totally, Duke! For lots more ThinkTech videos and for underwriting and sponsorship opportunities on ThinkTech on OC16, visit thinktechhawaii.com. Be a sponsor or a volunteer and help us reach Hawaii.
I'm Duke Oishi. Thanks so much for joining us on ThinkTech. You can watch this show throughout the week and tune in next Sunday evening for our next important weekly episode. Aloha, everyone.
I'm Maria Kashem. See you next time.
ThinkTech is the bomb.
Okay, let's try that again.